Personal responsibility is a powerful idea, but it becomes an illusion when the environment makes the healthy choice the hardest one to make. For example, it's easier to quit smoking when those around you are encouraging you to quit. However, it's much harder when everyone around you smokes. This is an example of the social determinants of health, the foundational conditions in which people live and that profoundly shape their health outcomes. Welcome to PCP Lens, where we journey through metrics, money, and madness. My name is Sudeep Bansal. I'm a primary care physician in Connecticut, and I run my own medical practice. When I began my Determinant of Health series, the social determinant of health seemed like a natural starting point. But before exploring SDOH, I chose to focus on upstream influences, which I covered in my last 3 articles and videos: the political, structural, and commercial determinants of health. This video will focus on the social determinants of health. But if you've not read those articles or watched those videos, I strongly encourage you to do so, as all the determinants of health are interlinked. The WHO defines social determinants of health as the conditions in which people are born, grow, live, work, and age. These circumstances are shaped by the distribution of money, power, and resources at the global, national, and local levels. The US Department of Health and Human Services Healthy 2030 goal builds on the WHO definition and divides SDOH into 5 broad categories: economic stability, which includes employment, food insecurity, housing instability, and poverty; education access and quality, which includes early childhood development and education, high school graduation rates, and enrollment in higher education; healthcare access and quality, which includes access to health services such as primary care and health literacy; neighborhood and built environment, which includes access to foods that support healthy dietary patterns, how much crime and violence is in the neighborhood, environmental conditions, and the quality of housing; and social and community context, which includes civic participation, incarceration rates, and social cohesion. Another way to look at the socioeconomic determinants of health is using the Dahlgreen-Whitehead model. This shows the interrelated and nested layers of what affects health outcomes. The outermost layer includes general socioeconomic conditions such as living and working conditions, education, employment status, housing, etc. Nested under this layer is the social and community networks, and last is the individual lifestyle factors. Over the last couple of decades, a substantial amount of evidence is accumulated that suggests SDOH may account for approximately 30 to 55% of people's health outcomes, while medical care only accounts for about 10 to 20%. And in my very first video, From Doctors to Social Workers, I mentioned that socioeconomic and environmental factors heavily influence individual risk factors. So let's look at how socioeconomic factors affect individuals. Low income and poverty lead to a lack of resources such as access to food and healthcare, along with a chronically stressful environment. There's good data to show that people in the top 1% income bracket live approximately 14.5 years longer than people in the bottom 1% bracket. Education leads to employment opportunities and better health literacy, which then leads to better decision making. On average, adults with a high school diploma will die 9 years earlier than their college-educated counterparts. Food insecurity leads to poor nutritional intake, which increases the risk of chronic diseases. Not having job security leads to financial stress, which can then increase blood pressure and increase cardiovascular morbidity and mortality. Now let's look at housing as an anchor determinant in a little bit more detail and how it affects health outcomes. Where you live influences how you live and how long you live. And this happens because the neighborhood conditions shape access to safe housing, clean air, healthy food, schools, jobs, etc. There is very good data to show that your zip code is a better predictor of your health outcomes than any other health risk statistical calculator. Housing spans all the determinants of health, including political, structural, commercial, and social determinants. Political factors sets the rules of who gets what kind of housing and where they get to live. Structural factors lock in long-term patterns of segregation and wealth distribution. Then commercial factors come in and they shape what is built, where it's built, and for whom, based on the profit margins. And social factors determine the daily exposure to health risks. In my previous 2 videos, I examined the political and structural factors affecting housing. In this video, I'll focus on how housing, as a socioeconomic determinant of health, contributes to poor health outcomes. Housing affects health outcomes in numerous ways. This complicated mind map shows some of the major pathways. If you want to review this mind map, feel free to pause the video or view it on PCPLens.com. Let's look at 3 of these mechanisms in a little bit more detail. The first mechanism is how poor housing quality leads to asthma exacerbations. Water leaks in poor housing infrastructure leads to a damp environment. Along with poor ventilation, this enables growth of molds and pests in the house. These conditions then lead to a high number of respiratory issues, including asthma exacerbations. Generally, the same people also live in poverty and may not have access to healthcare and the asthma inhalers. The combination of these conditions then drives up ER visits for asthma exacerbations. And by the way, did you know that primary care physicians are held accountable for asthma-related ER visits? It's actually one of our quality measures. This flowchart shows how the US Department of Energy's weatherization assistance policy improves housing conditions, leading to improved health outcomes. This is an example of the health in all policies approach that I discussed in my previous video. When policy fails, medicine pays. The second mechanism is housing cost and rent burden. When rent exceeds 30 to 50% of a household's income, families are forced into difficult trade-offs, choosing between paying for housing, food, or medical care. This phenomenon is known as the housing cost burden, and it's an economic stressor that leads to poor health outcomes. Rent-burdened households are more likely to delay or forego medical care and to face food insecurity. Skipped medications, irregular meals, and delayed medical visits make it hard to manage chronic conditions like diabetes and hypertension, leading to higher cardiovascular mortality and morbidity. And lastly, housing instability or eviction risk creates a chronic stress response in the body. This leads to the activation of the hypothalamic pituitary and adrenal axis, which then leads to releasing several hormones in the body, including cortisol. This chronic stress response then leads to uncontrolled blood pressure, diabetes, heart disease, and other poor health outcomes. There's a lot of debate over the role of personal agency versus systemic factors leading to poor health outcomes. However, blaming individuals for unhealthy diets or lack of physical activity fails to recognize that housing in neighborhoods without safe sidewalks may not allow for physical activity and that there may be no grocery stores nearby. Similarly, when people are financially stressed, they may have limited time or money to buy and cook healthy food. Furthermore, commercial actors often target this vulnerable population to sell junk food as an easy option to their food problems. Couple this with a neighborhood where everyone is in the same boat. This then fosters unhealthy choices in the community, which then profoundly shapes individual behavior. For most people, it's not personal failure. We have made it hard for them to succeed. And yes, there'll always be people who'll overcome all these barriers and succeed in staying healthy. However, they're the exception, not the norm. The systemic reality is that most people face constraints that limit their choices. Picking up a hamburger from a local McDonald's is far easier than finding time to go to a grocery store, purchase groceries, and cook the food when you're the only person working, taking care of kids, and probably also elderly parents. Focusing on just personal agency has been a spectacular failure, with skyrocketing rates of obesity, diabetes, and heart disease. We need to focus on systems to allow people to make the right choice, the easy choice. You can find a written version with references to the material and audio podcast version on PCPLens.com. If you like this video, please sign up on PCPLens.com so that you don't miss the next episode when it's published. Thank you for watching this video. Take care and goodbye.